Hey everyone, I'm Heidi Murkoff, and I am so pumped up to talk about how you can feel empowered during your pregnancy and your birth and postpartum, how to find the right providers, and of course, how to celebrate my most favorite day of the year, Bump Day, on July 24th. And joining me to talk about all of it is Dr. Veronica Gillispie-Bell. You can call her Dr. Veronica. I have a feeling I'm going to. An OB and maternal health champion in Louisiana. Thank you so much, Dr. Veronica, for being here with us.
Oh, thank you for having me.
First things first, for those, this is our 10th annual Bump Day, but in case you haven't heard, the mission of Bump Day and our always and forever mission at What to Expect is to celebrate beautiful bumps and healthy pregnancies and healthy babies, and also to raise awareness about the huge disparities in maternal health care that we have in the US and how we can all close them by working together, so that every mom everywhere gets the care she needs before, during, and after pregnancy so that she can deliver a healthy beginning and a healthy future for herself and the baby she loves. And doctor, you are an advocate for all moms. I call myself a mother lover. You're a fellow mother lover, and especially though for moms who face disparities in care. That's your passion. Can you tell our moms why it's so important to find a provider who sees you, who hears you, is both respectful and responsive, and why you should consider, if at all possible, to change providers if you're not feeling that support?
Yes, Heidi, thank you so much for that question. It is such a vulnerable time during pregnancy, and it's a time where your body is changing, this thing is growing, this baby is growing inside of you, and there's a lot that's uncertain. And so you have to have a provider that you trust, not just from a clinical perspective, but a provider that you can talk to, that you can bring your questions to, a provider that never makes you feel dismissed, that never makes your questions feel like they're dumb questions. You just have
Mm-hmm.
to have that level of trust. And it really reminds me of a patient that I had that at the beginning of her pregnancy, she gave me a coffee mug that said, "Do not confuse my medical degree with your Google search." And it was our little joke because every time she came to her prenatal visit, she would say, "Doctor, I know I'm not supposed to do this, but I was looking on Google, and she knew I was fine with that. What was most important is that we had a relationship of trust. That even when she did her own research, she always would come to me and say, "Is this right? Is this okay? I just want to check with you first." And so, really, that is the relationship that should exist between the patient and their care and her care provider.
Absolutely. Of course, you could always Google on what to expect, because that's stuff you can trust. But always check your provider and ask. And if you hear conflicting things, your provider is always the person you should check with. Um, Do you? I think all of us have probably had that experience, though, as you know, especially during pregnancy, but in any time of our lives where we go to the provider and we bring up something that's very personal, or you feel very vulnerable asking, or it's just a concerning symptom that you are worried about and it's legit to you, but your provider says, that's normal. That just comes with a pregnancy package. Oh, everybody feels that way postpartum. I, you know, I would love to know what you think a mom should do if she's getting that kind of response from her provider.
Yes, I think for any mom that's getting that response should seek a second opinion. And I'm just going to say we have countless stories in the media of individuals, women coming forth and saying that they had a concern or an issue. We have Serena Williams. She was at the desk saying, "I'm having shortness of breath," and they dismissed her and said, "Hey, that's just a normal part after you deliver your baby." And had she not spoke up, she may have died. She had a pulmonary embolism. I had that experience. I was out of town at a conference. I was about 25 weeks pregnant. I was having abdominal pain. And my colleagues, it was an OB/GYN conference, my colleagues encouraged me to go to the hospital before I got on the plane. I went to the hospital. I said, I'm having pain. I think I may be having contractions. They did not do the appropriate evaluation. They told me I had colonic inertia, which was a fancy word for constipation. Never asked when my last bowel movement was. Thank goodness. I
Oh,
know. So, and I didn't want to be that person, that doctor. So I didn't challenge it or say anything. And so that's also, my fault as well. But I feel like I'd already said what the issue was and they weren't listening. And so, thank goodness, when I came back home later that day, I saw one of my friends was at the conference, and she was like, "Let me evaluate you." And she did an ultrasound, and she said, "I don't want to scare you, but I really don't see your cervix, so I'm gonna just do a vaginal ultrasound. Your cervix should be at the minimum 25 millimeters." My cervix had gone down to 9 millimeters because I was actually in preterm labor. So fortunately, we were able to slow the contractions down, get steroids on board, all of those things. And I did deliver early, but not as early as I would had we not intervened during that time. So it can be the difference in your survival, your baby's survival. So if you are a patient and you're bringing up a concern or a condition and you're not being heard, you deserve to be heard and you deserve to seek care from another provider.
I know this can happen to any mom. But do you feel it happens more often for moms of color, for Black moms, for American Indian, Alaska Native moms?
Absolutely, it does. Just speaking one as a Black woman, and from doing the research on this from a health equity standpoint, women throughout time have been characterized and put into different stereotypes, but Black women in particular have been assigned different stereotypes, and one of those stereotypes is the angry Black woman. So that has blunted us as healthcare providers when we hear our Black patients have a concern or have an issue, then that stereotype, that bias becomes active of the angry Black woman. And so we become dismissive. And then also as Black women, because we don't want to fulfill the stereotype, we
Right.
often don't speak up anymore. And so there definitely is a difference because of implicit, not explicit, but implicit bias and just the stereotypes that have been assigned to women of color, Black women, American Indian women, Alaska Native American women. As you mentioned, those stereotypes that have been assigned get into our unconscious bias, and that does affect how we deliver care.
And imagine if you weren't a physician, you didn't have access to your friend who could evaluate you. You weren't Serena Williams, even, who had somewhat more power in her voice, and her partner also, to speak up. Then you. That's why we're having this conversation, because this is a pervasive problem, and we have to make sure that all moms are seen and heard. So do you think, kind of jumping off of that as a Black woman, you are more likely to get the care you need, more empathetic care from a Black doctor? Or as a woman in general, that you're more likely to get it from a woman? Or, maybe even if you are low risk, whether you should be getting that care from a midwife. So, what are your thoughts on that?
So I can tell you what the literature shows, and the literature shows if you have concordance of race, meaning that the race of the
Yeah.
physician and the patient are the same, that we do have better outcomes, not just maternal, but infant,
Yeah.
primary care outcomes. So the data does show that. The reason that happens is because there is a level of trust that is established just when you see somebody that looks like you. I think we forget about it as healthcare providers. When patients come into the healthcare space, they lose all of their power. They're coming in because they need help. They're coming in and we're speaking a language that they don't understand. And we still have a hierarchy in medicine that as the provider, whether I'm the nurse or the doctor, I have all of the knowledge. So therefore I have all of the power. And so it says something when you walk in a room and you see someone that looks like you can immediately drop your shoulders and exhale because you know you at least have culturally shared experiences. Now, that doesn't mean that a provider of a different race cannot establish that same level of trust, but it may take a little bit more and you may have to work a little bit harder. In terms of midwives, yes, absolutely. We should be incorporating midwives in a collaborative way into the obstetric practice. By 2030, so we're talking about in 6 years, across the United States, we will be short 5,000 OBGYNs. 5,000. And we do not have more medical students choosing to go into OBGYN. So we're not going to be making that up. And so we need to really think about leveraging our midwives to provide care for our low risk patients so that we as physicians can provide care for the higher risk patients. It is the only way that we're going to be able to expand the obstetric workforce because we're not going to have enough OBGYNs.
No, and around the world, there are far more midwives, and most of the low risk care is provided by midwives, and that works really well. And by the way, they have lower maternal mortality. Just saying. So I think that's really critical that we are training more midwives, getting more midwives out to communities where they're most needed, and that could be especially in rural communities where a lot of the facilities have shut down. There's no OB for how many miles, and getting, not just mobile care and telehealth, but also more midwives where they're needed. And I also think that no matter what doctor you are going to be seeing, or midwife, having a doula by your side really helps, because it helps you advocate for yourself. They're advocates for you. They support you through the process. They answer questions. They don't give medical advice. They don't deliver your baby, but they are your support system. And that's invaluable, I think.
Oh, I so agree. Doulas are so important to the pregnancy, the birth, and the postpartum
Yes.
experience. We know the data shows that when doulas are involved in care, we have better breastfeeding initiation rates, we have lower C-section rates, and it's for the things that you've said. And as I've said, when we have patients come into the healthcare space, we're speaking a language that they don't understand. And so doulas really serve as that advocate and that liaison between the medical world and then the patient's world. And they're able to speak up for that patient when the patient's not able to speak up for themselves. And then I think if we look at our maternal mortality rates and the timing that that's happened, the majority of deaths are happening after discharge up to 6 weeks postpartum. And if you think about the way the healthcare system is designed in the United States, patients deliver their baby, they go home, and then they don't actually come back into the healthcare space until 6 weeks postpartum. And clearly, there's a lot of things that are happening during that time. And so I think postpartum doulas are so important because they actually come into the home. And so they're able to not only address clinical concerns or be able to advocate for patients to come back into the clinical space if something is not right, but they're also able to understand social, local, community, cultural differences and situations that may also be barriers to accessing care.
And it's something that you see all the time in other countries. There's always someone who is your support person. Um, in an urban hospital in India, we saw, a sign saying every woman needs to be supported. Every woman needs a support person by her side. And so in African villages that we visited, there are women who support other women in that community. We need that here so much. And it's such, in terms of cost, it's money so well invested in our moms and our babies. And I wanted to add about doulas is that they also reduce the risk of postpartum PTSD, birth trauma, depression, other perinatal mood and anxiety disorders, and that's the support talking.
And that's so important. If we look at maternal mortality from the 38 maternal mortality review committees, we know that mental health conditions is the leading cause of pregnancy
Yeah.
related deaths. and that being mental health conditions, suicide, substance use disorder, all comprised in there. But and again, mortality is just the tip of the iceberg. There's more morbidity that's 100 times more than the mortality cases. But suffice it to say, perinatal mood and anxiety disorders are a big contributor to our maternal outcomes. And as you've mentioned, doulas are so important for being able, one, to understand and to be able to even recognize signs that something's not right, for patients to be able to come in to get diagnosed. But also, I think as healthcare providers, we have a feeling, because it's the way we've been taught, that if we do a delivery and we have a healthy mom and we have a healthy baby, we accomplished what our goal
Yeah.
was. That
Yeah.
is like the bottom baseline. And also, experience is also a big part of that. And so, childbirth can be very traumatic for a lot of different reasons, even if we have a quote unquote healthy mom, healthy baby, good outcome. And like you said, doulas are so important for being able to understand that, recognize that, and help our mothers process that trauma.
Absolutely. I say doulas are a must do.
I love it.
So one of our What to Expect community moms asked specifically for tips on interacting with her physician and advocating for herself as a woman of color. What advice would you have for her, especially because we've all seen the stats, we've all heard the scary stories, um, and understandably so, that makes pregnancy and birth very frightening for women of color.
Yes, the first thing I would say is don't wait until you're pregnant. So
Mm,
during the
great,
time that
great.
you're even thinking about getting pregnant, seek out that care provider, spend time with that care provider, see, even talk to your friends, but seek care from that provider and see if that's going to be a good fit for you. And it's not only about race as far as the fit, but there's more to it. I tell patients when they're coming to see me, sometimes they feel embarrassed, or they feel guilty, I should say, that they're seeking a second opinion. And I tell them they're seeing me for a second opinion from somewhere else, and I tell them, don't ever feel guilty about that. I am loud, I talk a lot, I like to educate. I'm never going to tell you what to do. We're going to make a decision together. That's not everybody's cup of tea. So it's okay. It's okay. If we're not a good fit, then I'm not the right doctor for you, and that's okay. And so it's really important preconceptually to figure out if that's the right doctor. And if it's not, then find the right doctor for you, and seek someone else for your care. But it's important not to do that before you get pregnant.
Absolutely. And I would say that's a whole other discussion that we should be having about preconception, because a healthy beginning uh, of a pregnancy starts with a healthy mom before pregnancy, and a healthy dad for that matter. But that's for another time. I, I, I know that you work with many women who come into pregnancy with complications like fibroids. And that's another reason why you should get that care before you become pregnant, instead of just, oops. There are lots of steps that you can take before pregnancy to help ensure a healthy pregnancy. But let's say she has increased risk for whatever reason. Um, and she might need extra medical support or benefit from more monitoring. How does she know when to see a specialist? So, a maternal fetal medicine doctor. Are there things that she should think about ahead of time, like her family history? Do you know your family history? You should ask your mom and your sisters, and even your husband, your partner, and his mom, because you can have an increased risk of preeclampsia from his side of the family. What about your age, your gynecological history? Did you have a previous preterm birth, or pregnancy loss? Right? Are there chronic conditions that put you at greater risk? Like maybe you're overweight or you have hypertension. Um, so, what would you say? What are some tips you can give on how a mom can find that kind of specialized care?
Yeah, so I think that's a great question. First of all, as a primary OBGYN, my threshold for coordinating with my maternal fetal medicine team is very low. So it doesn't take much. You're going to see the maternal fetal medicine specialist.
Yep.
And I think that's a question that any patient can ask their primary OBGYN is, do you recommend I see a maternal fetal medicine, and at what point in the pregnancy? Because really there are so many conditions that can increase your risk for a maternal complication or a fetal complication. It's all the things that you mentioned. If you're over 35 years old, then that puts you in the advanced maternal age. I don't know, people started talking about advanced, this geriatric age. I don't know where that came from. I still call it advanced maternal age, so that's what we're going to stick with. But that puts you at risk as well. And so, any of the things that you mentioned, plus age, all those things are reasons to see a maternal fetal medicine specialist. And so that's a question to ask, even at the first prenatal visit.
Yeah.
When do you collaborate with a maternal fetal medicine specialist? Will I see a maternal fetal medicine specialist? The way my practice is set up, we have our ultrasonographers that work with our maternal fetal medicine specialists that do all of our ultrasounds, first trimester anatomy ultrasounds, subsequent ultrasounds. And so all of our ultrasounds are read by the maternal fetal medicine specialist. And so they make recommendations as far as, this patient should be on aspirin. This patient needs to have another ultrasound in the third trimester. This patient needs to be on prenatal testing. We do have guidance from our professional society, American College of Obstetricians and Gynecologists, as far as when that extra testing is needed. But because patients are beautiful and complex, it's really important to have that MFM perspective to take all of those things into consideration for those patients that don't fit into a box, which is no patient. No patient fits into a box. To be able to say, hey, this patient has some risk factors. And so, again, it's a question to ask at that first prenatal visit so that you can better understand how your primary OBGYN works with the high risk physician.
That's great advice. We know that women of color, especially Black moms, are among those that are at higher risk for preeclampsia. Um, would you recommend that Black moms, especially if they have other risk factors for preeclampsia, and that could be hypertension, it could, pre-diabetes, or lots of things that could put a mom at greater risk. Do you think they should ask their provider about taking low dose aspirin?
Absolutely. I, I quite honestly, this is not the recommendation, so I don't necessarily do it, but there's not really any side effect or any negative effect. If you look at the criteria, almost every patient qualifies for low dose aspirin. But
Yeah,
yes, as you mentioned, for Black patients, for me, pretty much all of my Black patients after the first trimester, we start low dose aspirin, because it really has been, it's the one thing that we found that has reduced the rate of preeclampsia. And so
yeah.
yes, they should be asking their provider about that.
And do you think every mom should have a blood pressure monitor at home?
I do. This may not be again, I think some of the data on the self blood pressure monitoring, that data is just now coming out, so
Yeah,
not enough that it's been recommended by our societies that create our
right.
evidence-based practices. But I can just tell you from my experience, we have a digital health program at the facility I work with called Connected Mom, where all of our moms are offered a Bluetooth enabled blood pressure cuff at the beginning of their pregnancy, as long as they enroll before 20 weeks. It does not cost them anything. The institution covers the price. And so what it does is that they have the blood pressure monitor, they take their blood pressures, it uploads to their electronic health record through using their smartphone and an app that's on the phone. And the patients get text messages if they go a certain number, they go more than 8 days and they haven't checked their blood pressure, they get text messages until they do. And so it helps the patients to also be able to have some autonomy and to have some control of their own health. And because it gives them more information. And then for patients that have an abnormal blood pressure reading, they get a message saying, take it again and make sure it's abnormal. And then if it is abnormal, they get a message saying, go call your healthcare provider, go to the hospital. And then I get an alert that says the patient has an elevated blood pressure. With this program, I have diagnosed preeclampsia in between prenatal visits. We have found masked hypertension, meaning your blood pressure is normal in the clinic, but it's elevated at home. About 7% of our patients had that. 28% of those patients went on to develop preeclampsia with severe features. Suffice it to say, based on the data, I am a big proponent of being able to do self blood pressure monitoring.
Well, I am too. So this is something we're going to have to work on, because I feel, especially when you may not have access to regular appointments, if you live in a rural area, and then if you're even if you have access to telehealth, it's not going to help much unless you have that blood pressure monitor. And sometimes that's the only sign, right? You may not have other symptoms of preeclampsia, but your blood pressure is elevated. So I agree completely. I feel if you can get one, and hopefully insurance will cover it for you. Now, I want to turn to dads. And not everyone knows this, but I am definitely spreading the word. I've been spreading the word for years and years that fathers, when they're in the picture, can be the very best champions for the health and well-being of their partners and their babies. And research has shown an enormous impact on outcome. Healthier moms, healthier births, healthier babies, everybody safer. And that's one of the reasons I call myself a advocate, but why we have fought so hard for policies that would be more inclusive of fathers, especially in settings where they're often not included, where they're dismissed as, whatever, baby daddy. You stand over there, you're not even part of this conversation, which is ridiculous if you think about it, because we want fathers invested in that care. And when they are engaged by providers, that they will actually, be active participants in pregnancy, in postpartum, in things like safe sleep. Like if you're only telling the mom about safe sleep, and, you're telling her right after she gave birth, she may or may not remember it, but this makes it a partnership. So I would love to know what you think about how we can engage, how women can engage their partners in this whole process.
It's so important. I think there's so many times and intervals during the pregnancy when partners do need to be engaged, especially at the first prenatal visit. Lots of counseling happens at that time. In the third trimester, when things are really changing and when the maternal fetal risk increase, third
Yeah.
trimester is so important, and especially in the postpartum period. I always
Yeah.
tell moms, as we're talking about counseling and education for when you go home and looking out for the post-birth warning signs. If I'm the mom and I'm laid out on the floor, it doesn't really help that I've been educated. No, my village that is there to support me, including my partner, is the person that needs to be educated the most. So it really, really is important. And we have to think about it, I think, too, from a societal standpoint. We already don't have guaranteed parental leave for our moms, and we really don't have parental leave for our fathers. And so, what do we as a society then? What is that saying about what we think about the role of fathers? So, there's lots that we need to do in the clinic space, but also in the public policy space.
Absolutely, because he won't see those maternal warning signs if he's not home, if he's at work. He won't notice signs of a perinatal mood anxiety disorder. And you know how moms are. Oh, I'll be fine. I'll be fine. It's just a bad day. I'll be fine. And then she isn't. But if no one's there to tell her you're not fine, we need to call your doctor right away, then those signs might be missed. So that I agree. We just introduced, or we just brought a piece of legislation that was just introduced by Senator Warnock and Senator Rubio, called the Dads Matter Act, which calls attention to the need to engage fathers more in care, so they know the warning signs, they know what to look for and how to support their partner, so they have a healthy baby and a safe birth. So I I will maintain I am a advocate. So
That's
you,
awesome.
you see patients day in day out. You do obese, of course. There are probably lots of nights involved as well. Is there anything else that you want moms to know about getting the care that they need and deserve?
The only other thing I would say, and I've kind of alluded to it in a couple of ways here, that your care is not just about the clinical care. So it's not just about your doctor knowing how to treat preeclampsia or
Uh,
how to treat gestational diabetes, but it's also about respect. And
mhm.
privilege should never be the gateway to respect. No matter what that privilege is, privilege of color, privilege of socioeconomic, there should never be some type of privilege that gets you respect. You deserve respect. There is no reason that you should not receive it. And if you're not receiving respect, in addition, because I've heard patients say that they're like, "Well, I stay with that doctor because I know that they're really good at what they do." Well, there is a and they can be really good from a clinical perspective, and they can respect you. So if you're
And
not getting both of those things, you need to find somebody else.
they're not mutually exclusive.
No.
And find someone else. I know a lot of moms don't have a choice in the provider that they see, but they can still use your tips to advocate for themselves and to speak up. And if they're not being heard, to speak up louder.
Yes.
And get
And as you mentioned, if you are in that situation where you're in a desert where there's a very limited number of providers, for example, then see if you can have a doula involved in your care, because they can be the buffer between you and that provider. It's sad to say, and I hate to even say those words as if you need a buffer, but if your choices are limited, that is one way to give you more choice and more freedom.
absolutely. Thank you so much for joining us today. I have to say, your wisdom and your insight, I know it's going to help a, a lot of moms who are watching today have a healthier and safer and more empowered pregnancy and birth and postpartum, because it doesn't end with birth. It's a journey. And I also want to remind everyone that this year's bump day is on Wednesday, July 24th. So get ready to share your bumps, past or present, yours or one you love. I dust off my old Polaroids, or a video story or a message about your birthing journey with the hashtag bump day on social media. So thank you again, Dr. Veronica. Big hugs. One day soon, I hope in person. And I will see all of you on Bump Day.